My name is Jeff Garris. I am the Outreach and Engagement Director for the Pennsylvania Budget and Policy Center. We're really pleased to have a lot of folks with us on the line today. We're close to 100 now, and I think we may have a few dozen more people joining us as we begin. We are talking today about some of the impacts on state budget negotiations, on revenue in Pennsylvania, on employment in Pennsylvania as a result of the coronavirus pandemic. We have all of the lines muted, except for those folks who will be presenting today. We will have an opportunity for you later on in the meeting to ask questions directly of our presenters. The way we'll do that is we'll have you unmute, we'll have you submit, there's a chat box down at the bottom. You can just send a message via chat that says, I have a question. I will be monitoring that, keeping an eye on that. When we get to a time for questions, then I'll go in order and unmute your line if you have a question so that you can ask it directly of our presenters. And then when your question is finished, we'll mute your line and move on to the next one. So again, we will have an opportunity for you to ask questions. Just let me know via the chat box that you have a question, and we'll take those as we have time. Do want to thank you all for joining us again. We'll be recording today's call. We're going to be hearing from a number of experts in our policy department, as well as guests from Pennsylvania Health Access Network. We'll be talking a little bit about some advocacy efforts around the state budget and also around some federal issues toward the end of the call. So again, thank you for joining us. I'm going to turn it over to my colleague at Pennsylvania Budget and Policy Center, our Director of Campaigns, Kadida Kenner, who's going to give you a few tips on how to get the best view, or at least the view that you want for Zoom meeting today. Kadida?
Hello, thank you, Jeff. Appreciate that. Hi, everybody. Good to see you all. See a lot of familiar faces out there. Hope everybody's doing well. So I'm sure most of us now are Zoom experts at this point, or zoomed out. Lots of us are zoomed out. But at this point, I would just like to, for those of you who are on the line who may not be too familiar with all of the different things you can do with Zoom, just want to give a very quick tutorial on Zoom so that we can have faces being shown if you wish, or otherwise. So just quickly, if you are to scroll up on your laptops with the cursor up above, you see an option on the far right for a speaker view or a gallery view. I currently have mine in speaker view. I just like to see all of your faces all the time, so that's kind of how I have it usually. You also have the opportunity to exit the full screen if you have to check on something while this presentation is going on today. There will be a PowerPoint shown, so you also have the opportunity to see the PowerPoint and then also look at like 4 faces or so as this is going on, or the speaker presenting. So just keep that in mind when you scroll up to the top. When you scroll down to the bottom, you have the opportunity to unmute yourself when we get to that part. Also to stop your video if you don't want to show anything that shouldn't be seen while all 104 of us are watching. You can also have the opportunity now to click to see the 105 participants. It went down to 4. 104 participants. You can click on there. You can see all the folks who are currently on the line in case you want to do some private chatting. This is an opportunity to also network too. You get our opportunity to network and chat, because there is the chat box right next to that in which you can ask your questions of Jeff or any of the presenters, and we will put those in queue and make sure that you can ask your questions. There's also an opportunity for reactions. So if you want to send up, the thumbs or the clapping reaction, I'm sure all the presenters would love to see your reactions as these things are going on to keep this lively. So there are also 5 pages of folks. If you scroll to the right center, you'll see that you can scroll over and see the faces or names of folks that are currently here, 5 pages worth. And then when this meeting is over, please take the opportunity to be in the chat box. When you're in the chat box, there are 3 little dots that you'll see to the bottom right. Those 3 little dots, when you click that, you have an option to save today's chat, so that all the things that you see in the chat box, you can actually have that on a notepad file so that you can review these later, especially if there's any links being shared or any comments and things that you would like to save. So that's a feature for you as well. So with that, I'll pass it over. I think, Jeff, the only thing we're lacking from Zoom is some smooth jazz to start it off before we kick into these meetings. I think that's something we should write in for Zoom to do. Give us some music to get us going.
Well, if we do, I can assure you it will not be smooth jazz, which any jazz enthusiast can tell you is not actually jazz. Also, Kadida noted, you can see everybody on the screen by moving to the right center or center right. This will probably be the only time that anyone on the PBPC team will tell you to head over to the center right. So anyway, on that note, we have from our policy team here with us today, Director of Pennsylvania Budget and Policy Center, Marc Stier. We also have with us our Director of Policy Analyst, Diana Polson, who's joining us from Pittsburgh. I'm going to turn it over to Marc to begin talking a little bit about some of the impacts of the current COVID-19 crisis on the state's economy, on our fiscal health, on our public health, and also on the state budget. So on that note, I'm turning it over to you, Marc.
Okay. Okay, you should all see my screen now. Is that working?
Yes, looks good, Marc.
Okay, and you can all hear me. Good. All right, so I'm going to talk for a few minutes about the economic and budgetary impacts of COVID-19. I want to thank you all for joining me on PBPC Hollywood Squares for this venture through some of the very sad news that we're facing. This is a little bit about us. I think you know who we are. I'm not going to go through that. First point I want to make is that business closures and social distancing are working. This is very important to know, particularly at a time when Republicans are trying to end them both. On March 23rd, there were 644 COVID-19 infection cases in the state. They were growing at a rate of 34% a day. Today, the rate's down to 7%, but 22,833 people have tested positive. Over 2,000 are hospitalized, over 500 has died, and that was of yesterday, and I'm sure the numbers, which were just released a little while ago, are higher today. Some people said, well, that's horrible, and it totally is. Unfortunately, there are other people who are saying, well, this was not such a big deal. This is no worse than the flu, although in fact it is far worse than the flu. And so this whole thing was a mistake. But if you go back to March 23rd and you look at the rate of increase that would have happened and its impact if we stayed at 34% a day, right now 539,000 people would have the virus. Over 46,000 would need hospitalization, and that's in a state with only 14,000 plus hospital beds. 11,690 people would be dead, and that's just assuming the same mortality rate as we currently have. It doesn't take into account the additional mortality that would have happened because we did not have enough hospital beds or ICU beds or ventilators to take care of all the sick people. We have this business closure policy and social distancing policy has been a huge success. And we need to remember that. And we need to keep telling people who are saying we need to end it now that it has been a success and that we have saved thousands of lives because of it. And that's why we need to stay the course right now for both health and economic reasons. The health reasons are obvious. If we, even at 7% a day, there are a lot of people who are going to be infected. And if we all of a sudden go back to work and end the social distancing policies, what we will find is that rate will start going up again, and we will have another crisis on our hands. We need to get the rate down far enough that we can, through effective testing, which, by the way, we do not have yet in the state, and effective public health measures, quarantine those who are sick, trace their contacts, and make sure that we quarantine anyone they've come into contact with. That would enable us to operate at a much more normal economic level. It will enable us to avoid a further shutdown later in the year, which many people think is quite likely, particularly if we end these current practices much too soon. And that ultimately will create a more healthy economy as well as healthy lives for all of us. Because the economy, as we'll see in a moment, has been very much impacted by these shutdowns, but it will continue to be impacted if we have to shut down again in the future, or if fear of getting sick, fear of being out in public, fear of going to businesses has a continuing impact on economic activity in the state, and if, frankly, if people's lives being lost has a continuing impact on the economy in the state. So let's look at the economic cost. To be honest, we don't really know how to estimate it. The estimates of GDP loss vary widely. I've seen some people say that we are in recession levels of about a 30% drop in GDP for the current quarter, and that will continue into the next quarter and maybe far into 2020. Some people say it will recover sometime in 2020, assuming we don't have to have another period of business closures and social distancing. And some people say, we will see this play out over a very long time. I want to tell you a little bit about why we don't know and what we don't know. And to do that, I want to explain what actually has been happening. There are two kinds of impacts of what we're doing now on the economy. The first is what you might call the supply side impact. By shutting down businesses, we can't produce. If we can't produce, obviously the economy goes into recession. In addition, people lose their jobs, and when they lose their jobs, they can't consume. And that second part is the demand side impact. Now, what we don't know is first, how big the supply side impact is. It's just too soon to have much data on that. We also don't know when it's going to be relieved. If the Republicans in Harrisburg had their way, we'd all go back to work in a couple of weeks. I do not think that's going to happen. I think it's going to be well into May before most of us go back to work, maybe even into June. We also don't know whether we're going to have another shutdown later in the year, and that is a very real possibility. Some people say we flattened the curve, but we may have just pushed off the real bump again until much later in the year. And that's always going to be a possibility until either one of two things happen. One, enough people have gotten the disease so that there's herd immunity, or two, we have a vaccine. So we don't know how big the supply side impact is. We don't know when it'll be relieved. We don't know whether it will have to happen again. We don't know how big the demand side impact is. We know lots of people are spending far less, partly because businesses are closed, but also because they don't have enough money. When they do go back to work, we don't know how much they're going to, how soon that's going to happen. We don't know how much they're going to spend when they go back to work. Will they be too worried to spend at previous levels about potential further shutdowns and they'll start saving their money? Will they be too deep in a hole because they have back rent payments or mortgage payments or student loan payments or utility payments that they now have to meet and thus won't be able to carry on the regular level of consumer spending? We also don't know how much federal support we're going to have. We know the CARES Act put $2 trillion into the economy. The first relief bill did much, much less, but also added a lot to the economy. We don't know if there's going to be a fourth or fifth federal stimulus. We very much think there should be, and one of the things we'll be doing as advocates is calling for one in the near future. But right now, we don't know what that's going to be. So we don't really know the economic cost. We're beginning to learn something about the cost to people in terms of jobs loss. In 31 days between March 16th and April 15th, we saw 1.4 million plus unemployment claims in Pennsylvania. We think that that's roughly created a Pennsylvania unemployment rate, if you add that to the previous unemployment rate of 27.9%. Again, this is a rough number. We really don't know. But that's Great Depression level unemployment. And that just tells you how serious this economic impact is. Here's a little chart that shows you the huge bump in unemployment claims. The claims per week have been declining a bit, but they're still at levels almost twice what they were before this all started. Before we go on to the budgetary impact in the state, I would be remiss if I didn't point out that women, immigrants, and minorities are overrepresented in frontline industries. They're more likely to be working and more likely to be suffering from the effects of working because they're in essential industries. They're seeing people in grocery stores or at county assistant offices. They are suffering from much greater exposure to COVID-19. They're suffering from getting sick from the disease, from being in the hospital, and from dying. And you can see the tremendous difference, both with regard to gender, race, immigrant status, and status as the Hispanic. This is something that I think is very sad in terms of this disparate impact on our economy and on people, and it actually reflects the great inequalities in our economy, because we know that the positions that are essential are, for the most part, much lower paid positions than on average, and so we're asking people to work at lower pay and take on a greater share of the burden. I wrote in the first piece we did on the impact of COVID-19 that we should have the moral equivalent of wartime equality. This is a time when we're all suffering, and we should be making sure the suffering is equally shared. And I'm afraid to say it's not equally shared. And if the General Assembly wanted to be thinking about how to address this issue of the impact of COVID-19 on Pennsylvanians in a way that really deals with the most serious problem, they'd be thinking about how to make sure all those people in the frontline industries have the PPE they need, that they are paid well, that they're getting combat pay, because that is in fact what they're doing right now. I want to go on and talk a little bit about the budget. And, you know, I'm going to just give you some very broad figures here, because again, since we don't know how serious the problem is for the economy, it's very hard to estimate the impact on the state budget. There are three estimates that I've seen that I'm taking seriously. The IFL just came out, that is the Independent Fiscal Office in Pennsylvania, just estimated that the range of the 2-year hit to the budget in Pennsylvania would be between $3.1 and $5.7 billion. That's including the current fiscal year that ends in June 30th and the fiscal year that begins on July 1st, 2020. New York has said that their budget hole will be about $10 billion. Our budget is roughly half the size of New York. So, you know, a reasonable estimate is we'd face about a $5 billion cut. Morgan Stanley recently put out a report that said that they were expecting a 20% cut to revenues in state and local governments. That would be a cut of about $7 billion in the fiscal year beginning 2020. And if you add in the immediate impact in the current fiscal year, that's roughly $10 billion over 2 years. So what I've been telling people is the impact on the state budget will be between $5 and about $12 billion a year, because there's not just a revenue loss, there's a lot of new spending. Medicaid spending, for example, has jumped dramatically. There are other social safety net programs that automatically are increased when in the time of a recession. Frankly, there aren't enough. And that's a subject that Diana will talk a little bit about. We could be doing a lot more to increase the size of the safety net to protect more people. So the whole in our budget is between $5 and $12 billion over 2 years. We've gotten a certain number of federal funds to date. The first Relief Act gave the state roughly $800 million to supplement our Medicaid spending by increasing the federal rate by which it pays for state spending for Medicaid, or what we call medical assistance in the state. The second Relief Act, the CARES Act, gave the state, if you add up the 10 or so different pockets of money, about $4.1 billion, maybe 4.3 if you add some money that's going directly to local. Well, if you add money going to local governments, that's about another $1.5 billion. But for money that the state can use to fill a hole, it's about $4.1 billion. There may be a fourth or maybe even a fifth round of federal funds. We really don't know. But if you take roughly $5 billion in federal money, and we're looking at a budget impact of between $5 and $12 billion. You can see if we're extremely lucky, the budget will be fine. If we are not lucky, and if things are as bad as some of the people who think the economic impact is going to be greater than others, we could be looking at a hole in the state budget of between $5 and $7 billion between the current fiscal year and the next fiscal year. I wrote $1 to $5 billion hole. Actually, as I was rethinking this in the moments before we started, I realized it could be even greater. So what are our alternatives? One, we can cut the budget deeply. We could do that now when we pass a budget in before July 1st. We could pass a budget July 1st and say, well, we're going to revisit it later in the year because we don't know the economic impact. We don't know what we're going to get from the federal government. That is an alternative that this state has tried before in the Great Recession. It's an alternative we at PBPC very much think we should not follow. There aren't that many places to easily cut a lot of the state budget. A lot of things we just have to pay for: debt service, pension funds, the basic workings of the government, prisons, state police, things like that. So where we would cut would be basically where we cut in 2010, 2011: education funding, K-12 education and higher education, human services. Even that might not be enough to get to $5 billion, or if that's how bad it would be. We simply can't do that in this state. We know that the impact of the budget cuts, far less than $5 to $7 billion in 2010, 2011, were devastating. We lost 27,000 jobs in K-12 education. I'm not even sure how many in higher education. People who lost social services were very, very much hurting. And it wasn't just the direct recipients of the money. It wasn't just the schools, and it wasn't just the teachers and in our colleges. It wasn't just the towns that surround those schools. It wasn't just people not getting social services they need. The impact of state spending indirectly on the economy is dramatic. And when you cut a huge hole into state spending, you have a dramatic impact on economic growth in the state as a whole. After those corporate budget cuts, we saw this state economy grow much more slowly than most other states in the country. We saw, except for those that did what we did here, Louisiana and Kansas, where they cut even deeper and had worse economic results. We saw job growth in Pennsylvania be among the slowest in the country. And that was a direct and predictable impact of cutting our budget so severely. So we just can't do that. Second thing we can do is we can raise taxes on the richest Pennsylvanians. As many of you know, we have a fair share tax plan that would raise about $2 billion and cut taxes for lower income and middle income Pennsylvanians, which is a good thing to do right now. We'll get them spending again. We could do that, or even a more vigorous version of that proposal, and fill a budget hole. And that would have much less impact on the economy because rich people save a lot of what they earn because they earn so much they can do so. The third problem is we could actually just run a deficit. Now this is, and then sell bonds based on recurring revenues to fill the hole. We could sell bonds. I mean, this is technically unconstitutional, but 3 years ago we did exactly this. We did not raise enough funds to cover our budget. And at the end of the year, we were $1.5 billion in debt. And what we did is we sold bonds on tobacco revenues and raised that money, and we're slowly paying it back. There's still more tobacco revenues we could bond on. There are liquor control board revenues. There are other revenues on which we could sell bonds, and we could fill a hole that way. And you know that's not good budget practices. You're supposed to pay for your budget, at least at the state level, your current year budget with current year revenues. But in this kind of disaster, I actually think if the choice is between very, very deep cuts or doing something that is not usually thought of as a best practice and running a deficit, I would recommend running a deficit. I think that's second best to raising taxes on the richest Pennsylvanians, but we may have to do both. And as I said, it's unconstitutional. But you know, as I wrote 3 years ago when the state government did that, what's a constitution among friends? And with that, I'm going to stop and turn this over to Diana Polson. I think I need to stop the share of my screen, which I believe I just did that. And now, do I make Diana the host, or go back to you, Jeff?
No, you just make me the host again, Mark, and
Okay.
Diana will come on screen when she starts talking. We have a number of questions in the queue right now, Mark. Do you want to take them now, or should we just wait till after Diana?
If they're about what I just said, maybe we should take a break and have people ask them now.
Yeah,
and
why don't we do that
Diana?
now? Yeah. So you've given me the control back again. That's good. First question we got is from Noni West in Bucks County. I'm going to unmute her line. Noni, do you want to ask your question?
My question is, can you hear me okay?
Yes.
Yes.
It's regarding the flattening of the COVID curve. And what I've noticed is that although the curve is flattening, we are actually testing less people on a daily basis. So we were testing maybe 7,500 to 7,800 people a day. And now we're testing like 3,500 to 3,800 a day.
Mm-hmm.
So I'm wondering if we're seeing a false flattening, if it is flattening because people are not asking to be tested, or if we do not have the capability to test as many people.
That's a really good question. And I should say some of the initial high rates of increase may have been because testing was increasing at that time. We actually have some data we're going to be posting about that. The two lines don't correspond that closely, so I don't think the high rate of increase in the middle of March was just about new testing. But you're right. It's absolutely critical for us to be testing. One of the things we're going to be writing out very soon is that we're deeply, deeply concerned that this state does not have the public health capacity to test, either because we don't have enough tests, and then we know the federal story about why that's true, but we also don't have enough spending on public health, on nurses, and on investigators to perform the tests and to quarantine people, to track those they've been in contact with. So it's not just an issue about knowing where we are. It's an issue about how do we ultimately go back to work, and even if we get the rate of transmission of the disease down, if we can't test people in order to limit the increase again. So that's a really serious question, and I don't know the answer to that right now. I'll try to look into it some more.
Thank you.
Thanks for your question, Noni. I believe we also have a comment from Ted Mowat in Harrisburg. Ted, you want to ask your question?
Sure, I guess, and I confess that I haven't read everything that you guys have put out or put up on the website about this issue, but my observation is, with the rollout of this, and I know that there's probably another, 15 or 18,000 waivers that haven't been even, adjudicated yet. I have some issues with some of the criteria that they've used for what jobs are essential, or why even they use the term essential. That can be one category, but it shouldn't be the only category. Of also having occupations that are not likely to spread the thing because they don't come in contact with other people should also be allowed to stay open. And I think that would mitigate some of the pushback from the Republicans if they had other jobs where there was a different criteria, or even if as Corman said, and I realized that those were suggestions from CISA, not supposed to be standards, but it's something to look at as another possibility of keeping some of the economy open. I'm really worried about the food chains and that kind of thing staying around. If there's farmers now throwing milk away, and there's the meat companies are announcing they're closing, those are real issues that have to be addressed and aren't really being addressed by the governor and the simple stay home edicts.
Well, that's a good point. I was actually writing something this morning that said, the Republicans made two arguments with regards to SB 613. One of them I kind of think they have a point, and that is in the rollout of the business closures and the waiver process. There was a lot of things that were done haphazardly and inconsistently and maybe not totally transparently. I don't fault the governor for that. We were in the middle of an emergency. People weren't even working in the same places. They were trying to figure out how to keep the government working and at the same time process these applications. But I think, it would make sense for the governor to be rethinking some of those decisions. I think that's a legitimate point. But if you look at the energy behind what the Republicans did the last 2 weeks in the House, it wasn't about making the system fair mostly. It was about people demanding that we just reopen the government as soon as possible. And that's just utterly irresponsible. And the bill they wrote, which was horribly drafted, could have been read in 2 different ways. And I'm very glad the governor's decided to veto it because I think it could have been totally dangerous. So I think there's a legitimate question about, given the closures, can we rethink in some ways the criteria? Now that the government has a moment to breathe again, should they go back through some of those waivers and try to make the process a little more consistent? But then there's the other issue of you have people protesting in Ohio and Michigan, just saying open up the government. We're going to have a protest just like that next week in Harrisburg. I think those folks are to be honest, I think they're dangerous themselves, because the more you encourage people to violate the business closures and stay-at-home orders, that's a public health danger in itself. I think moving this legislation and talking about it the way they did, it was a public health danger.
Yeah, well, there's no doubt that part of the reason that the governor has stuck to his guns on this is that people are ignoring the simple request to stay home and stay safe. So he's doing things like that he had gone back on other things like the masks and that type of thing. And there's symbolic shows of we're trying to get people to to cooperate, and they're just not. A lot of people are, obviously we all are. But I go to the grocery store still, and and some other things. But that's there has to be a middle ground, as Lisa Boscola said yesterday in the debate. And right now, the governor's got all the Democrats in the House and the Senate stuck with having to stick with voting no, rather than there being an honest discussion about how to make this better. Well,
I think I didn't see much of an honest discussion on the Republican side about. As I said, they were giving 2 different messages, and the real appeal was the wrong message. So I think there's room for the governor to rethink stuff, but we have to give him an opportunity to do that.
Marc, in the interest of time, we have Diana Polson, our policy analyst, is in demand and has somewhere else to be at 2 o'clock. So we're going to switch over to her. I would encourage you, Marc, to go down to the chat box and click down there. A number of folks have submitted questions that are open, for everyone to see. While Diana's going through this, if you want to go into that chat box and maybe reply all to some of these questions, we can answer some of them there.
Sure, I'll be doing that. And I'll be around later if there are more questions too. Thanks, Jeff. Thank you all. Thank you all for listening.
On that note, we'll sure. Thanks, Marc. We're going to turn it over to Diana. Diana, I think you need to unmute your line.
Can you hear me now?
Yes.
Okay, great. Hey everyone, nice to see you. Thanks for joining us. I hope everyone is hanging in there. I know these are challenging times, and I, for one, I'm used to working from home, but now having to juggle having my kids around and keeping them alive and fed and now educated is a challenge while also trying to work. And I know all of you guys have your own challenges. So I hope you're hanging in there. Last call, I talked through our policy agenda that we'd like to see in response to COVID-19. And in the last couple of weeks, we've been trying to stay up to date on what's been done in the state and what is in the works. We focused on 3 main areas: economic relief, healthcare, and worker protections. So I want to give an update from the last call since things are moving so quickly in the state. So I'm going to start by talking about some advancements Pennsylvania has made in the area of economic relief. On March 18th, the state Supreme Court ruled that no landlord or bank can evict a tenant based on failure to pay rent or mortgage payments, and at present this extends to April 30th. The Pennsylvania Public Utilities Commission issued an emergency order on March 31st that establishes a moratorium on public utility service terminations. Another thing we've seen is in-person requirements when applying for assistance at county assistance offices have been suspended. Heath closed on April 10th, but will reopen again for crisis assistance likely in May. And this will be funded in part by the Federal CARES Act stimulus money. Emergency SNAP assistance will be expedited and issued within 5 days of application. In terms of unemployment insurance, Pennsylvania, as Marc has talked about, has seen a huge increase in UI claims, about 1.4 million since the virus hit Pennsylvania. And staff members are working to respond by processing claims and setting up a system to implement the newly passed federal program called the Pandemic Unemployment Assistance Program, and that will cover a broader range of workers. From what I've been able to find out, at least as of last week, the state had processed about 500,000 claims. This does not cover newly eligible people. Pennsylvania is still creating a process to implement the pandemic unemployment assistance, which I believe the feds have just issued or will soon recommendations on. My understanding is that this should take a couple weeks to get up and running. The expansion and strengthening of the UI system is happening on both the federal and the state level, and some of the changes, I'll talk about some of the changes. Pennsylvania has brought back retirees to help process new claims, and they are bringing on an additional 100 staff. Most staff are teleworking to comply with CDC guidelines, and there's been a backlog of PINs to access funds, but this is trying to be resolved from what I hear. As I talked about last time, the usual week-long delay before workers can receive their first unemployment insurance payment has been waived, as has the work search requirement. Unemployment hearings can now be done by telephone. Gig workers and the self-employed can soon access the pandemic unemployment assistance. The Federal CARES Act increases weekly benefits by $600 through the end of July. In terms of healthcare, the state has placed a moratorium on public health benefits loss as beneficiaries return renewal forms but do not do interviews. Governor Wolf signed an executive order that requires all healthcare providers, manufacturers, and others to report their current PPE inventory and be prepared to submit them if there's a higher need in the state. In the area of worker protections, Dr. Levine signed an order that requires businesses with at least 50,000 square feet used for commercial, industrial, or other enterprises that are still operating to clean high-touch surfaces in a way that complies with CDC standards. Another order by Dr. Levine just yesterday focused on the protections of workers in life-sustaining businesses. And what this would do, it would require employers to provide masks for employees. It would stagger work start and stop times, provide sufficient space for breaks and meals. Employers would need to conduct virtual trainings where possible, maintain 6 feet apart rules. It would also provide information in other languages for non-English speakers. It also requires customers to wear a mask and lays out a process for if an employee tests positive for COVID-19. One other thing to note, on April 10th, Governor Wolf issued an order to release vulnerable inmates from state prisons, which could potentially impact about 1,500 to 1,800 people for temporary reprieve. For inmates serving time for nonviolent offenses who are within 9 months of release, or vulnerable workers within 12 months of release. Now I'm going to talk a little bit about new legislation that will be or has been proposed that we're keeping an eye on. Representative Frank Dermody has a resolution. It's HR 843 that has to do with expanding SNAP to online grocery purchases. SNAP recipients are currently unable to use SNAP for online grocery purchases. This resolution would urge our Department of Human Services to submit an application to join an online purchasing pilot, which is happening in several other states. And this would enable Pennsylvania SNAP participants to purchase groceries online. One of the things that some of our partners are trying to push for is trying to set up a program where smaller neighborhood-based retailers could accept online SNAP purchases, because my understanding is that this pilot would mostly benefit national retailers like Target, Amazon, and Walmart. Representative Austin Davis has a bill, HB 2411, to support frontline healthcare workers. This bill would do three things: invest in PPE to help protect frontline healthcare workers and their patients. Number two, establish mental health supports for frontline healthcare workers. Number three, create a child care grant program for frontline healthcare workers to ensure that they're able to afford high quality care as they work during this crisis. Representative Jean McNeil plans to introduce legislation that protects Pennsylvanians from having their internet and cable services terminated during a declared disaster emergency. Representatives Mary Louise Isaacson and Summer Lee have introduced HB 2404. This would protect tenants from eviction during a state of emergency, protect those who are unemployed, separated from their employment, or unable to find employment, and landlords who violate this would face penalties. Representative Morgan Cephas has HB 2403 and HB 2402. This would waive interest for student loans through the PA Higher Ed Assistance Agency and loans issued by the Pennsylvania Housing Finance Agency. Senator Farnese and Representative Hohenstein introduced legislation which would fill in gaps in the paid leave provisions in the Families First Coronavirus Response Act, which is a federal act. Senator Maria Collette and Lindsey Williams would introduce frontline worker protections. This would include, emergency funding for safety equipment, prioritize frontline workers in COVID-19 testing, as well as some other things. Representative Ronnie Green and Melissa Schusterman are looking to introduce legislation that would forgive student loans for nurses and personal care and assisted living facility employees who are fighting COVID. They put out a memo around April 7th to try to pursue that. So this is all a work in progress, and things are changing fast. If you all see or hear of other things, feel free to be in touch with us, because we're trying to, update our Excel spreadsheets, which you'll find soon on our website. Jeff, I'm handing it back to you.
Great, thank you so much, Diana. There are a lot of questions folks are submitting. One of the questions I think was related to the bill numbers related to SNAP. I think that Katie on our team may have put that into the chat box already, and we'll try to get that out to folks.
Yeah, it's HR 843. And I think it was proposed right at the beginning of April. One thing that I should note is that all of this information will be on the Excel that we can have Jeff send around a link to, and it includes links to proposed legislation so people can access the details there.
Thanks, Diana. And for folks, a few people had asked in some of the questions submitted via the chat box. We are recording this. We'll make the video available for folks to watch later on. And I think we'll also get Marc's slides and send those out as a PDF to everyone who's registered for this. So we'll get that to you and some of the other materials as well. So I think I'm going to take one or two more questions here from folks that I had told that I would be calling on them shortly. One question we have is from Coleman. Coleman, I've unmuted your line. If you want to ask your question, you can go ahead.
Yeah, my question is to to Marc. Talking about state spending, particularly for education. I was wondering, with this, and maybe looking back at the Great Recession as a as some type of guideline. Would it be possible to revisit the spending that goes to charter schools, say for special education, and other educational spending with regard to tax credits in the form of VITC, OCTC. Would this be something that might be palatable to to this legislature, as far as making cuts goes, given the extent of the recession of the.
Sure. That's a really good question. Just off the top of my head, I could come up with, $750 million of state spending that I think we shouldn't be doing because it adds to economic inequality. And there's the Racehorse Development Fund, which increases purses for racehorses that owned by Middle Eastern sheikhs. That's $250 billion. There's about $200 billion in charter school funding that we could recover if we had good laws that regulated charter schools and paid them fairly. There's you mentioned the what we call the bad EITC, the tax credit that sends state corporate tax funds to private schools, mostly helping very, very rich people attend school, expensive schools. You add that all up, it's about $750 million. I'm sure I could find some other tax credits that don't really serve any use, but help relatively rich business people. So there's $750 million, $1 billion there. This General Assembly will not cut any of that. We don't think. This is not a political. This is not a political call, but you can draw your own conclusion.
Thanks for the question, Coleman, and Marc, thanks for answering that. We're going to take one more question here on the phone before we move on to Patrick Keenan from Pennsylvania Health Access Network, who's going to share a little bit more information and a call to action with us. But we have a question from Pat Albright here in Philadelphia. Pat, I'm trying to unmute your line. I think you may need to unmute on your end. There you go. You're on. Pat, I'm not hearing you.
Okay,
There you go.
I had raised in the chat that I work with the Global Women's Strike. Just wanted to. Can you hear me now?
It's breaking up a little bit, Pat.
Video.
Okay.
Yeah. Okay. Is that any better?
Yes, that's much better.
Okay.
Thank you.
What I wanted to raise is the need for waiving of delivery costs, as well as being able to make purchases online with SNAP, and also the need for increases in SNAP and that will also benefit those who already have maximum SNAP benefits. I understand that some of so that those who are sort of with the least, who are struggling with the least resources, can benefit from some of these stimulus packages and other things that are being proposed. So that was a main concern. So I need thoughts on that and how we can organize around that, those issues.
My colleague Kadida Kenner is online. Kadida, do you want to just say a word about that? Because she's doing some organizing about it.
Let me see. I may need to unmute Kadida. Or Kadida, you may need to unmute on your end. Oh, there we go.
Okay. Hi, everybody. Yeah, I'm currently, actually right now in the midst of writing an op-ed in regards to SNAP and where it stands. And I put a lot of information there in the comments section, the chat box, as it's related to that. Yes, there is Frank Germany's. Let me pull up some of the stuff I have so far. We have Frank Germany with with his memorandum, he's looking for co-sponsors, of which there are many, for House Resolution 843. There's just a lot of information going on right now. I mean, I've been on the agricultural site, USDA site, about Supplemental Nutrition Assistance Program, SNAP, for those out there. And yes, it is a federal program, but there is a pilot going on, an online purchasing pilot that's happening right now that Diana spoke to a little bit before. Right now, it's in Alabama, Iowa, Oregon. And this happened on April 1st, where they're piloting a program. It's also been expanded to Nebraska, where they're piloting a program right now. And as Diana mentioned, it's only happening like the Amazons, the Walmarts, some ShopRites, Wrights markets in Alabama, so some smaller grocery stores as well. But the problem that we're discussing and what you're seeing is that, number one, these folks are still gonna have to pay for the delivery because SNAP benefits won't cover the delivery fees for this. So that may be a problem for some folks. Also, the fact that we have to get smaller grocery stores or bodegas and things that take SNAP to be able to assess this, because not all of them have the means to do this online with online purchasing. So, I mean, there's lots of things that need to be looked at. I think that Representative Frank Dermody's bill is a good start. There's obviously things that we need to do to make sure that we can make this more accessible for everyone. But yeah, I'm willing to, grateful to take any of your questions and comments in the chat box, because like I said, I'm currently writing an op-ed for this right now.
Sorry, thanks, Kadida. And again, folks can submit that in the chat box. Kadida will be working on this. Also just got some information from Ann Sanders at Just Harvest out in Western Pennsylvania with some ways that folks can take action related to SNAP issues. I'm going to put that in the chat box here momentarily. We'll continue to try to answer as many questions as we can in the chat box. We may do a few online. We are just coming up on 2 o'clock. We will go a little bit over for folks who want to stay around and continue the conversation. But I do want to welcome and introduce our friend and ally from the Pennsylvania Health Access Network, Patrick Keenan. Patrick, I'm trying there. I think I've got your line unmuted. There you go. Go ahead.
Thanks, Jeff. Thanks, Mark. Thanks, Kadida. Really appreciate a moment of your time. So as everyone heard, Mark and others talk about 1.4 million Pennsylvanians filed for unemployment recently, and this is going to create a surge in enrollment for Medicaid. Newest estimates predict that somewhere between 459,000 and 1.041 million Pennsylvanians will become newly eligible for Medicaid. And the ask right now that we have is Congress is considering putting together another stimulus package. And one of the key things that was left out is a bump in the federal medical assistance percentage akin to what we did in 2008. So just a quick review of what's kind of happened so far. The Families First Coronavirus Act did add a 6.2% bump to our Medicaid funds, which injects a lot of needed money. But right now, that's nowhere near what we did during the Great Recession of 2008. Pennsylvania, received a huge impact from economic hardship increases to the FMAP as well, which would add, based on Center on Budget and Policy Priority projections, another $1 billion into the Medicaid program. So right now we're getting some funds, but we need more. The other thing that we need to be really cognizant of is that the current bump that Congress had put in place with the Families First Act is scheduled to end when the public health emergency ends. And with the Congressional Budget Office saying that economic conditions, and as we heard Marc say, will last well into 2021, we really need them to extend the enhanced Medicaid funds. The last thing, and really important to a lot of folks, I see a lot of folks connected to older adult issues or people with disabilities. We really need to make sure that any congressional action includes what's called a maintenance of effort requirement, which would prevent cuts to benefits or new eligibility barriers, premiums, other things that might hurt people. And the number one thing that would be at risk if we don't get these increased funds, and if we are looking to cut Medicaid, is home and community-based services for older people and people with disabilities. Dental care could also be on the risk. There's lots of things that are on the line. One of the things, so there's 2 actions right now. Generally, it's really important to put this on the radar of all of Pennsylvania's members of Congress. We have a targeted action only for leaders of organizations and other folks that have been engaged in Medicaid advocacy or are concerned about this, where they can easily contact their member. Also, we just encourage you to contact your member, directly. You don't have to use the tool, but it's important to put these 3 points on their agenda. The second thing is if you happen to live in a Democratic member's district, there is a letter going around by Representatives Doggett and Castor that is going to be submitted to Speaker Pelosi this Friday. So it's the timing here is really important. We're hearing some talk about some of this package being pulled together, but the Doggett-Castor letter will go to Speaker Pelosi at the end of this week or early next week, and Democratic members are encouraged to sign on by then. So those are the 2 things we're looking for, Democratic members to sign on to the Doggett-Castor letter, and then also just general awareness that Congress needs to act to increase, and add additional bonuses to the federal medical assistance percentage, that they need to keep that through the duration of the economic downturn, and that we, keep these maintenance of effort requirements in that will protect our most vulnerable Pennsylvanians. So huge budget issues here, and this would directly help improve our budget situation if these actions are taken by Congress.
Thanks so much, Patrick. I just put into the chat box for everyone a link to the tool that you have set up for folks to send a message to their member of Congress. So that's there if folks want to find it.
Thanks, Jeff.
Great. Thanks so much, Patrick. We are just at 1 o'clock, maybe about 1 minute after. I know that there are still some questions we've not gotten to yet. So I'm going to ask folks, and I know that my colleagues, it's been a remarkable team effort here with people on the team spread out all over the state, following up on some of the questions that have been asked via the chat box. But if you still have a question or a new question or one that's not been answered yet, just please send a message quickly in the chat box. You can just send it to everyone. Just put in the words question, and I will call on you and unmute your line if you have any. So if you still have remaining questions, please just send a message quickly in the chat box, and we'll try to take those right now. If folks need to leave, you can go ahead and do that. We are recording this. We'll get the recording and slides and other materials out in a follow-up email to everyone shortly. Any additional questions folks have? Just give them another minute or two if anyone wants to type in that they have a question. Okay, I see I have a question here from Kristen. Kristen, I am going to unmute your line so you can ask that directly. Trying to see, I'm not finding you in the, hold on, let me scroll down here. Oh, okay, here we go, Kristen. I've unmuted your line, you can ask your question.
Sure, thanks. So my question was about health insurance. I know sometimes when someone transitions out of a job or loses a job, the option of COBRA exists. I was wondering, with so many people being furloughed or laid off because of this crisis, does the Families First Act or the CARES Act address that? Does it prevent an employer from discontinuing your health insurance once you file for unemployment and offering you the option of COBRA, which I just kind of popped in my head when this bill passed, because I think that could become a real issue.
Sure, let me say a word about that. One of the things we're learning from this crisis is how problematic employer-based health insurance can be, because people do lose their insurance when they lose their jobs. COBRA is usually required, but COBRA insurance is often incredibly expensive. So the best choice for most people is to get on either Medicaid if their income's very low, or to purchase insurance through the exchanges. which in some cases may give them good insurance at a reasonable cost if their income's relatively low, but if they're above about 250% of the poverty line, it tends to be much more expensive. One of the things we had hoped that the federal government would do would be to reopen the exchanges, and that would allow people to apply for insurance through them. If you lose your job, you can apply for insurance through the exchanges, but you have to document, you have to give them a lot more documents than you would if they had just said, okay, we're reopening the period of time for people to purchase insurance. Unfortunately, as we all know, President Trump has been trying to kill the Affordable Care Act and was not willing to open up the exchanges. And also, unfortunately, we have not yet instituted a Pennsylvania healthcare exchange to replace the federal one. If we had a Pennsylvania healthcare exchange, we could have made that decision here. So there are other opportunities for people. You know, they're just not easy for a lot of folks.
Thanks for your question, Kristen, and thanks, Mark, for that answer. We have Chris on the line with us. Chris has been waiting for a while to ask a question. I've unmuted your line. Chris, go ahead.
Hi, everyone. Thank you so much. I actually asked two, but I'll ask the first one. Going back, Mark, to your very helpful presentation, the numbers you were showing in there, do they also include what's going on with PennDOT, both in terms of the highway funds as well as the public transportation and trust fund?
No. You know, we already have a problem, you know, with public transportation, with the Act 44 money running out next year. I don't know that there's an immediate, well, I don't think there's going to be an immediate hit on state funding for public transportation because that money is locked in terms of how PennDOT funds are transferred to it. Of course, if we have a serious budget deficit next year and it carries over to the year after, and we're looking for $400 to $500 million to replace the PennDOT funding for public transit, then you know, that makes that problem even harder to solve.
Have you been tracking legislation? It was introduced, I think, by Senator Ward last year about the step down of the Turnpike Flex between now and 2022 and offloading that onto the general fund, because that's coming up right now.
Yeah, I doubt that the General Assembly will take that up anytime soon. You know, it's not the last minute, and our General Assembly tends to deal with things like this only in crisis mode. And as I said, they've got so many other fiscal issues to deal with that no one's going to want to address this right away. But it is certainly a time for transit advocates to be talking about this. And actually, I have a call later this afternoon to talk with some people just about this issue, because the end of that money for public transit is a very serious threat to the economies of not just Philadelphia and Pittsburgh, but the other 12 or 13 cities around the state that have bus transit systems that play an important role in their economic lives and are particularly important for low-income people in those cities.
Thanks so much, Chris. I put in the chat box a moment ago, we'll take one final question by phone for those who are still on the line. I got a message from Jordy Cummins in the center part of the state. Jordy, I'm going to unmute your line. You can ask your question.
Yeah, hi, thanks. I was on a call about a week ago that Local Progress had organized nationally, and Ocasio-Cortez was there, and she was talking about something that she said could happen at the state and federal level. And so I'd be curious, I didn't get all the details, but roughly it went like this. Why don't we forgive rent for this period? And it seems like either it's planned or in the stimulus bill that people who pay mortgages have basically a temporary moratorium, and banks are getting help. So the basic logic was just forgive rent, right? Because, you know, what's the point of like a 1 or 2 or 3 month hiatus? Because most people pay rent, if they get a 3-month rent bill due in May or June, that's just going to lead to evictions and be massively disruptive. So I didn't get the policy details. I understood the basics of what she was saying. Most mortgage holders are going to make back whatever rent they were going to get over the long term when they sell it or with other renters. And at the end, she kind of said, it's kind of a backdoor universal basic income. So if Marc or other people, is that something that you've seen as a more solidified policy proposal? Is it something the state can do? Because, at the surface, it seemed to have a lot of merits.
There's a lot the state could do and a lot the federal government could do. That's one interesting idea. Just talking more broadly for a second, our policy of helping people unemployed is very different from what's happening in Europe. In Europe, they're basically paying employers a lot of money, but telling them you've got to keep people employed, which is far less disruptive for the labor market. It's far less certain for people who have lost their jobs and now have to go hope they can get their job back. It would be far easier to restart the economy. Similarly, the proposal you're talking about is a way of ensuring that once we all get back to work, people have money in their pockets to keep spending. We come up at PBPC with policy ideas that are just beyond what we think can happen in this General Assembly, and these are some ideas we should be looking at. We have a real barrier right now in the state with the General Assembly that is not sympathetic to any of these ideas. The answer is yes, of course we could do many of these things, but no, we will not at present. But we should start talking about them, and we're going to be working on and that's when we will look at.
Thanks, Marc, and thanks for your question, Jordy. That'll be the last question that we take on the phone. We are keeping all of the questions and comments that folks have submitted via the chat, which we'll be sharing with folks, along with the slides and the recording of the video, and following up with some other resources and materials. Before we wrap up, I do want to let folks know we have been planning and had actually reserved the Capitol Rotunda for Tuesday, June 2nd for Budget Advocacy Day at the Capitol. Obviously now with some of the restrictions in place, we're not going to be able to be there in person. We will be doing some online actions and some other ways that folks can weigh in on the state budget and priorities and things. We'll get that out to you shortly. But if you were planning to and had on your calendar June 2nd, 12 noon, Capitol Rotunda, we will not be there that day. I do want to wrap up by thanking all of our presenters and all of my colleagues from PBPC who helped out with today's call. I want to thank Marc Stier, Diana Polson, Kadida Kenner. I want to thank Adrian Stanley and Katie Personette, who helped out with a lot of the links to some of the reports and answering some of the questions. I want to also thank our friend and colleague at the Pennsylvania Health Access Network, Patrick Keenan, and want to thank all of you for being with us here today. We'll continue to keep you informed about other meetings that we'll be having coming up. We plan to be back on the line 2 weeks from today at 1 o'clock for our state budget advocacy work. We'll also have some other webinars coming up, and we'll keep you posted on that. I'm going to unmute everybody's line, so you're welcome to say goodbye as we wrap up the call today. Thanks so much, everybody.
It shows
Bye-bye.
they're after. She lost her leg. She stayed on active duty for a number of years.
Thanks, everybody.
Training.
Thank you. You will.
Classroom.
Very good class.
Hey, I'm gonna get ready to
stay on active duty.
get ready to head out.
She didn't take a medal.
I don't want him anymore. He offered them to his dad first.
But she also fought to be deployed for a year.
And again, I put this video on.
And I'm sorry, Kadida, you were saying something?
Yeah, you can stop the recording so you don't have to edit this out later.